Hello, everybody. Welcome to the Healing Arts Podcast. Today I had the great pleasure and honor to speak with Dr. Chera Hope. She's a physical therapist, and we had a great discussion that spanned quite a wide range of what the physical therapy world is like in general, and also what her specific and unique approach is within that world. And it gave me a great sense of what is possible, that not all physical therapists are the same, not all of them think the same, not all of them practice the same. I learned a lot, I got a lot out of it, and I hope you get a lot out of it too. Another thing that I am a little bit excited about is towards the end, we talked about misconceptions in both the physical therapy world and also in the chiropractic world. And I thought that was a fun little aspect towards the last couple minutes of what we talked about. So I hope you enjoy the ride, and let me know what you think. Thank you very much. Okay, yeah. So I love that you said that we're when we team up, we're more powerful. Mm-hmm. It's so true, and part of the reason why I'm so excited to have this conversation with you today is that I don't know what your experience has been like, and I'm very curious about it. But my experience as a chiropractor has been that I have heard a lot of chiropractors trash talk PTs.
Yeah, vice versa.
Okay, so it goes both ways.
Uh-huh.
Okay, good, great. Well, I'm sad that we're on the same page about that, and I'm also happy that we're on the same page about that, because that's, the one previous to this was chiropractor, and I'm very adamant that the next one should be PT, so that we can have a literal side-by-side comparison. Yeah. And what I hope to demonstrate, and I'm confident that we will do exactly that today, is that we're maybe not so different.
Yeah, I agree, and I've learned that more over the years. I feel like early in my career, it was like competition, and I feel like folks with more acute pain, like wake up and can't turn my neck kind of thing, like they instantly think chiropractor, and PTs are like, well, we can do something with that too, and so I just feel like there was this like competition over patients. And when I moved, I lived here my kids try to age me, the late 1900s. Back nice. In like 98, I was doing pediatrics then, and then left for like 15 years and came back. So I've been back for 10 years, but like the connections I've made in the last 10 years, have really changed like my view on many things in the healthcare field. And I've met amazing chiropractors, amazing acupuncturists, amazing massage therapists, herbalists, like you name it. And I opened my clinic up 8 years ago wanting to find a more holistic place for patient care. And then since I've opened, I've even met more amazing folks in the community, and it's just really opened my eyes. This is a huge town. Like, I don't feel like even other PTs that I am friends with that own clinics, like I never feel like I'm in competition with anybody. And I just feel like, if we all have more of that attitude, like we can make such a difference in people's lives if we share clients and, hey, like this isn't really my expertise, so I would love for you to go see so-and-so because, you're the focus. We want to get you feeling better. And so yes, it's really been a learning experience, especially since I opened up my clinic, just kind of banding together more in the healthcare field.
Yes.
And that's not how things started out for me, like forever ago. It was very much more like, oh, you're an acupuncturist, and, like, you go do your separate thing, and that has nothing to do with what I'm doing. And then I started learning more about energy and meridians and like all the things and how you just can't get around some of that stuff. And then befriending chiropractors and talking more about what they do. I'm like, we all like have the same goal.
Yes.
So,
yes, to help the patient, to
100%,
help the client.
yeah.
That should be our goal. And if we come at it from this angle or that angle, it's all good in my mind, at least. It's all good. We just want to help our clients, and you have a slightly different training than me, and I have slightly different training from you, and
right.
Or maybe big differences in certain areas, but in any case, it doesn't matter. I think it's helpful to have those different frames of reference so that we can all help each other. So maybe could you tell me a little bit about what PT school is like? What kind of stuff do you, and I know that that's a huge question, but maybe if you could give us like a summary, like what kind of stuff do you learn in there?
Yeah, and I think it's changed and, dare I say, improved some over the years, because I graduated in 1995 when it was just master's programs. Now they've all changed and they've added an extra year or so on, and it's a doctorate program. But like super intensive, which that has not changed. We had 2 years straight through. Now we have 3 years straight through after your bachelor's. But you just are kind of thrown in the anatomy lab from day one. I remember walking in and like seeing our first cadavers laying there and thinking this is going to be an interesting 2 years, and we're all kind of squeamish, like to touch and try to be very respectful, and and then fast forward like a year and we're just kind of leaning on you're trying to get to what we're trying to get to, and like super curious and stuff, and like that's a interesting change. But lots of anatomy, like from day one, and we consider ourselves musculoskeletal professionals. Like that's kind of our thing, and so like just all of the biomechanics of the body, and in addition to that, how to interface with patients and how to evaluate and assess. That was a huge part of it. And then they kind of put you out there, and I'm sure you guys had the same. They put you out there in practicals where like you're going to go over here for a month and practice on people under your clinical instructor. So just learning how to look at the body holistically, which I feel like they do a much better job of now. Like,
how so?
Well, I think things are maybe like PTs come out now with more research-based knowledge, and I don't remember talking about a ton of that in school. It's just like, okay, like here's a cervical spine, and when you turn right, this facet glides down, and like the biomechanics of things. I think that PTs now, there's more research behind it that they present in school. Like, this is why we do what we do, kind of thing. These are the outcomes when we do this. And I feel that they have more manual skills. We did some, but we also, I feel like in early PT school, we're maybe more exercise based. And I think that's why people have a vision of, I'm going to go to PT and they're going to make me do exercises. Like, that's kind of the majority of what we do. And that's definitely changed over the years. And I hired
more towards manual application.
Stuff. Yeah. And actually like listening to the nervous system a little bit more, because so I graduated with my master's, and I knew from the start I'm going to be a pediatric therapist. So I went into peds and married an Army guy, which meant we moved around a ton. So was in Fort Hood, Killeen, Texas, and there was no great peds clinics around. So started at a manual therapy clinic and realized I better, start learning all the manual therapy stuff. And I realized I'd been missing a lot of that in school. And so just, the PTs are kind of con ed nerds or whatever. And so we're constantly like learning new things or whatever. But
what kind of nerd did you say?
Con ed, continuing ed. Yeah. Okay. So like we just, like, I feel like the more I learn, the less I know. Oh my gosh, I wish I had known this like 20 years ago when I was doing these, peds patients, and like I'm trying to get this joint to mobilize, but I wasn't doing anything to address the nervous system. Like, it took some years for all that to come together. But I think you get good basics in PT school. A lot of PTs will come out pretty confident with basic manual therapy skills, good interactions with clients because they've like had to practice a ton. Hired my first new grad. I always just had in my mind that, you know, new grads are not the same as they are now, now as they were when I graduated. They're much more confident, and I just feel like they have more skills. And so I had in mind when I opened my clinic, well, I remember how I was as a new grad, so I need folks that have some experience and some confidence. And so I hired my first new grad about a year ago, and she like, you know, has like blown it out of the park. Like, amazing connections with clients, and you know, so
not just confidence in her own mental, like I'm the best, but actual confidence that she's actually good at what she's doing.
Yes.
Because those are two different things.
100%. I know. And you can get a lot of like book smart PTs that graduate that come out kind of like, you know, they have to learn those skills and like how to read people, not just be like, well, we're going to do this and we're going to do that, but just really learning to listen and connect with clients. And I think in PT school, I mean, it's pretty rigorous, and you don't like, you know, they tell you can't have a job while you're in PT school. This is your job. So for the next 2 or 3 years, like, you're going to eat, sleep, dream, anatomy, physiology, you know, all the clinical stuff you have to do. But I really do think PTs these days come out even more prepared than I just remember being very timid. Like, I knew the stuff, like the book smarts, studied my butt off, and I knew the stuff, but like just was missing that, like, you know, am I confident enough to really talk to the patient and tell them what I need to? And I just don't see that anymore. I see PT students coming out like very confident about.
That's interesting.
Yeah.
I did not come out very confident.
Yeah.
I did not come out
I was
school
terrified.
super confident. Yeah, me too. It's like, oh man, I feel like halfway through the program, I was more confident than I was at the end of the program, something like that.
And I think maybe like coming out and doing pediatrics, like, because the kids weren't really judging me, you know what I mean? Like, maybe like helped with that a little bit in the beginning, because like it was like play therapy for them, and I'm great at like playing and making things fun, and so I think that helped me kind of ease into it, because the kids didn't know if I didn't know what I was talking about.
Nice. That's fun. That's fun.
Yeah.
So you mentioned listening to the nervous system like 1 or 2 times. I'm very interested in that statement. Could you maybe explain what you mean by that?
Yeah. So I'll talk about earlier in my career. So I was in Fort Hood, Killeen, Texas, a pediatric therapist. And I suddenly found myself working in an outpatient orthopedic clinic, and I didn't know what the heck I was doing. So I'm like pulling all my PT books back out, all the manual therapy stuff. And so I thought, you know, I need to like up my game a little bit. So I started to take manual therapy classes through University of St. Augustine, which is a big manual therapy school.
In Florida.
In Florida, yeah. I have one in California now, and Stanley Paris started the school, and big famous PT, lots of research. And so during that program, it was great. Like, it was all about biomechanics, you know, like I was talking about the cervical spine, but it was kind of like, this is the only way you can do it. And so you have the patient lay, you approach them from a 45-degree, you know, angle, you know, with your MCP, and you're gliding in this direction, and this is the direction, physiological direction of the joint. So you just go right in, like, okay, person can't turn their head right. Okay, let's assess why. Okay, and then let's just get in there and like do it. So years of doing that, and didn't always work. And so I just started looking more at like, why didn't it work? Like, why is this person like coming in like anxious and stressed? They've been in chronic pain for years, and why can't I just go in and manipulate and mobilize that and just fix it and they're good to go? So I started really listening more to why, learning more about the vagus nerve and the inverse relationship of vagus nerve tone and inflammation. And, inflammation is a huge thing in our society these days, just with all the autoimmune stuff and our diets and all that stuff. So I delved into the world of microcurrent and how that can address some changes in the nervous system. Took some classes like probably 10 years ago or more, 15 years ago. The dolphin microcurrent point stimulator folks, Doc Bruce, who started the company, is an acupuncturist / chiropractor. And so he wanted other healthcare professionals to have a way to access the nervous system when we're not allowed to put an acupuncture needle in there. That's just not our training. And so, I had some PT friends that went to the class and they came back, oh my gosh, you would not believe. And I was like, whatever, it's just some device or whatever. I got my hands, I'm good, I don't need a device. And so had them do it on me, and I was like, oh, I feel some release in my hip from those couple points you hit. And so it's basically, stimulating acupuncture points in the body, which we can have a map because we don't learn that stuff. So, hey, you've got back pain, these are the these are shoe points down the spine or whatever. And by stimulating these acupuncture points, you're accessing the nervous system. The interesting thing, PT is dry needle. And the interesting thing is if you take a map of known acupuncture points over a map of known trigger points that was mapped out by Janet Travell, forever ago, there's an 80% overlap. And so we're kind of all treating these same points that change the body and the nervous system. We're just kind of doing it in our own ways. An acupuncture needle into the meridian, or a trigger point, dry needle into a trigger point. But anyway, so that introduced me to, hey, there's the golden triangle that are these heart and lung points. And when I have a patient come in that's super revved up, they might not want me to just put my hands right on them and start jamming on their joints or let's exercise. So, we'd have a calm conversation. They'd lay down. I've worked in clinics where it's a big open gym with tables and and that was not very calming and restorative to me. And so when we opened our clinic, it's private treatment rooms. It's HGTV. There's dim lamps and lights and music and blankets and all that stuff. And you can make the room dark. But started playing around with, okay, let's see, if we hit the golden triangle first, which we know is Valium for the body, how does that change things? And I'd have a patient come in, sit on the table, oh my gosh, I can't turn my neck to the right. Can you work up here? And okay, what do you have going on? Oh my gosh, my dog just died, and I blah, blah, blah. So let's lay down and then hit the golden triangle, do the acupuncture points with the microcurrent, and sit back up and retest it. And look at that, you can turn your head. I did not have to go in there, address the nervous system first. So that kind of started changing everything for me. And so we have pulled frequency specific microcurrent, and we still do the dolphin points for folks because it's 15 seconds on each point it's super powerful. But I'm hoping that's the way that PT is kind of, going towards. I know that in my manual therapy stuff, I learn, release the diaphragm. If somebody's flex, you got to do this, you got to do that. And then, beyond that, okay, let's look at breathing patterns. There's just so much more. I kind of nerd out on all that stuff, but there's so much more we can do, not just, let's just mobilize and then go do your exercises kind of thing. And so we are definitely way more nervous system centered, because I feel you have to get through the layers to have changes last. And so, you take a patient early in my career, and I would just be okay, let's mobilize, let's do this. And they come back and it was right back to the same. Do it again. Come back and I'd be right back to the same. I'm okay, what am I missing here? Why is this not, staying improved? Why is everything all revved up again? Well, back in my day, we didn't learn a ton about, the nervous system and how that influences everything in your body.
Yes.
Your gut, your inflammation, your muscle, everything, your sleep patterns, which, can jack your vagus nerve tone up. And so it's been really fun the last 8 years. My practice has changed immensely from when I first opened the doors. It was just me. I'm doing my manual therapy stuff, and then I had a pelvic floor PT come into town, and she was like, I really want to work here. Like, I've checked out other clinics. I love your philosophy. I was like, well, sorry, I don't do pelvic floor therapy. I didn't know much about it. Well, let me build your program. Let's do this. And then just like the things I learned, all the connections, like, oh, my plantar fascia patient that like got 50% better, but like I was kind of stuck with that. Go talk to the pelvic floor therapist. Oh, their pelvic floor is very weak and they are on one side and they're gripping and stabilizing with their plantar fascia, their foot intrinsics. And so until we address this, you can't fix this. And so just really opened my eyes to like so many things. And I still feel like I need to learn more. I want to learn more, but I love the direction that's taken, because like we're not necessarily traditional PT anymore. And
your particular office.
Yes. And I just like kind of hope everybody goes that direction, looks at all the things like the sleep patterns, the breathing, the nervous system kind of stuff. But yeah, so I feel super blessed to have like the amazing team that we have. But I think what changed everything is stepping back and like, you learn a PT school. This is how you do this. This is how you do that. If, if they check the boxes off, okay, it's a compression of this nerve, you got to do, you know what I mean? Just following like the
protocol.
Yeah, the protocol. And Lord knows when I graduated, like the protocols like that I printed out in my little book, like, total knee replacement. We must do this at week 1. We must do this at week 2. And that's great, like, to have that, but there's so much beyond that. Like, when we started dry needling, like popliteus and some of the muscles that were like affecting the knee, and working on the scar tissue using microcurrent to release deep adhesions, like a whole nother world opened up. And so like I know I could nerd out and talk about that all day, but
that's what this is for.
Yeah,
you're in the right place.
Yeah, I love it. And I love talking with other, like holistic healthcare providers and seeing like what they do, what do they offer, like what do they find that works, because like I said, the patient's just going to benefit the more we kind of, like connect and share experiences and stuff like that.
Yes. I expected to find a lot of differences between our worlds, and I don't know if I expected to find as much differences immediately.
Yeah.
In just the couple minutes so far that we've been talking, following protocols is something that I also learned in school.
Yeah.
The line of drive, the 45-degree angle, the step off to the side, and this is the angle of the facet joint, and it's like, oh my! Did you go to chiropractic school or PT school? Because it sounds extremely similar, and another thing is that I did not expect any kind of emphasis on the nervous system as you have been describing it. My conception, what I have been kind of fed by my colleagues, is very musculoskeletal, exercise oriented. And that's fine that there is some level of that, but it's I'm loving this so much already. Another thing that you just said one word of it, but I'm curious if you could unpack that a little bit. You said that this person came into your office talking about how how did you say it? I'm surprised that there's such a philosophy in your office. You said something about a philosophy of care, a philosophy of like how you deal with your clients. What do you mean by that? What do you mean by a philosophy of care?
So, like you said, I think PT, like people think physical therapy is I'm going to come in and exercise, and they're going to make me push through it even if it hurts, and they're going to stand on the side and count my reps. And there's like t-shirts that are jokes about PTs losing count of how many reps or whatever. Another thing we get is massage. Hey, do you guys do massage? And I'm like, where did that even come from? You know, can you massage me? I'm like, I have a great massage therapist for you. You know, like that's not what we're going to spend our time on. We will do soft tissue. We learn soft tissue mobilization, but it's not going to feel good necessarily like a massage. But so I think we have, and we see a lot of chronic pain folks. We see a lot of pelvic floor trauma folks. And we have a huge military population, and it's a little sad that there is trauma history, especially with women in the military, that I didn't realize. And so, you know, we see a lot of really complex folks. It's not like, oh, I had a knee replacement. We do get some of those. You know, I was in a cast, my elbow won't straighten, can you fix that kind of thing? But I think over the years, we have learned to kind of peel back some of the layers and realize there's so many other things that there's probably causing that problem. Instead of just going right into my manual therapy, okay, let's mobilize and let's stretch and let's do exercise. So I think folks enter the clinic sometimes if they have PT, like history of other types of PT, which is all great, and like exercise is totally appropriate for some folks. They just really need to strengthen, but it's not appropriate for everybody at the beginning. But I think folks, you know, patients come in and they're like, oh, my doctor referred me to a fourth PT clinic, and here we go. Okay, you got my exercises printed out for me. And so I think like it's exciting for me because I've had to work at the front desk some lately because we've been a shorter front desk person. So I get to sit there and I can watch the patient when they come in, like grumpy a little bit. And then when they leave and they're like, oh my gosh, this is amazing. So I think it's really fun to like change those like perceptions of what PT is and what they're going to do, and have them realize like all the things. Like we are super blessed to have 45 minutes with each patient, which in this insurance day and age, we are fighting tooth and nail for, because it really, like all the things that we do, we need that time. There's not many clinics that can hold on to that anymore because insurance reimbursement is getting so low. And so, but I think having that connection with folks in a private room and like, you know, you see your patients, you know, like over and over, you get to know them, like, oh, you said your grandkid, blah, blah, how'd that go, whatever. So I think there's this emotional bond that we get with our clients that somebody necessarily doesn't if they're just walking in to see their nurse practitioner for a visit every 6 months or whatever. But the philosophy of we're not just here because like your shoulder doesn't move. We're gonna look at everything. I want you to stand up. Let's assess everything that's going on. And pelvic floor PTs are amazing at talking about the trauma stuff once the patients trust them, because there's that component, and we always make sure they're in with the appropriate, you know, counselor or whatever, which has been nice to work as a team with folks like that. But yeah, just like kind of changing maybe like the traditional PT visit, and I feel like we don't have to see them as many visits, and we like empower them with a lot of knowledge. Just a lot of what we do is education, and you know, and like I said, in my early career, you know, I might have had 10 or 15 minutes with a client, and then the next one, and then the next one, and you had a PT tech over here that was like in the gym doing exercises, and you're trying to pay attention, but oh, she needs to do 10 more reps kind of thing. So I feel so blessed to have the setup and the ability to really like spend the time and just like get through all the layers, because I feel like that gives more success, and they don't keep coming back for the same thing. And we do have return clients because they know what our care is like, but they're like, man, my shoulder feels so good. I like, you know, biked 50 miles this weekend and my knee is killing me. Like, can you just look at that or whatever? And so, yeah, it's been a blessing to just kind of morph like and really like improve and change like what maybe people think traditional PT is.
Yes. Okay, so you tell me what you think about this. I kind of want to give back to you, and you tell me if I kind of understood this right. So it sounds to me like you have a lot of different tools in your tool belt, a lot of different like ways of approaching, but listening to the person and their unique situation, not just the musculoskeletal concerns, but also the past history, emotional world, all these kinds of elements, and you sort of like see where is the best, and then you use the tools that are appropriate to address the person as a whole from a good set of listening skills.
You got it.
Does that sound okay?
Yeah.
Is that a fair summary?
Is.
Okay,
yeah.
cool.
And I feel thankful, like, other places I've worked or other healthcare professionals that don't have that amount of time, like, it's not their fault. Like, they don't always have the time to make those connections and get through all that stuff, because they're like, okay, I've got to get this joint moving better. I've got to like improve this so that when you leave, you'll feel better. And so to me, it's just like this huge blessing to have that amount of time, that we really can kind of delve into some stuff, which is pretty fun.
Awesome.
Yeah.
Awesome. Okay, so how many PT clinics do you think are the way that we're describing here, versus how much are maybe you also are contrasting the more traditional, typical. So what would the contrast be, and how much, what's the ratio of clinics in your estimation? I know you don't have exact numbers, I don't expect you to, but like, what's kind of your sense of the traditional, typical versus kind of the way that you're describing it here? Does that question make sense?
Yeah. I think that it's a very small percent of clinics that are not traditional. And unfortunately, I think reimbursement drives that. Like, maybe the clinic would want to do that, have more time or whatever, but, to make money, you got to see 2 to 3 patients an hour, unless you can figure out some other cash-based thing, as an adjunct to help offset the low insurance. And so there are some definitely more manual therapy clinics in town, some great ones. We have some great ones. And as I get older, I kind of would like to be a part of like getting the word out, and maybe like, talking to PTs about look what you could do also that like is so powerful if you just even have like 5 or 10 extra minutes. So I think we're unique, and it makes me a little sad because like I don't want that to be unique. I want that to be like, I want everybody to have those tools. But I think like once I started learning some of the nervous system stuff and the microcurrent, like I just kind of went down this rabbit hole of like all these cool things. And we had an acupuncturist / certified drug needle therapist that I met through Bonnie Shannon. They've been friends forever. I had a horrific car accident a few years ago where driving down I-25, minding my own business, and somebody lost control over here and T-boned me going 65 miles per hour. I flipped down the highway 3 times, hit the guardrail, broke my back, broke my femur. So I was like pretty jacked up. And so I met, Shannon, this acupuncture, or this acupuncturist / certified drug needle, amazing like genius lady, who was like, oh, let me just assess some things. I'm in town. She lives in Florida, and then let's try. I know you know about microcurrent with the stuff you're using, but let's try some frequency specific microcurrent that actually, like, we know the frequency of all the tissues in our bodies, right? That's a scientific fact. We know what the frequency is of the dura and the whatever. The nerve cells, the muscles, all that stuff. And as we start to lose those frequencies, that's when, sickness and dysfunction and viruses can affect that. That's when we start to have issues. And so she was like, you are a mess. Your neck is atrocious. So Bonnie's going to lend you her MEND, MEND, frequency specific machine. And I want you to just work through these protocols, because this microcurrent is specific to whatever tissues it is targeting, because you can change the protocols or whatever, and we can target for inflammation, we can target for cellular healing, we can target for removal of adhesions or whatever. And so you can I was like driving the next day, like I did some of the brain concussion protocols. Didn't know my back was broken for a couple months, but like I noticed like pretty quick changes using the protocols, and I was like, this, like, something's amazing happening here. I was back to work in no time with a broken back. I didn't find that out till later.
Was that like
it was just
compression
yeah,
fractures?
It was just compression fracture, T1 through 4. So like just certain things that irritated or whatever. But so I got to firsthand experience, but Shannon kept talking about, you got to do the concussion, like let's address the brain stuff. And I was like, who addresses the brain stuff? Like I'm a PT. We don't talk about brain stuff or whatever. Like we're muscles, and yes, that is attached to the nervous system, but go talk to your counselor or go do your neurofeedback or whatever. And so it opened another door for me. So I was like, okay, so now we can access the nervous system in a different way and run these protocols. And guess what? There are trauma protocols. There are protocols that target the medulla. There are protocols for anxiety that like target the tissues and make changes. So it's not like patients will sometimes ask me when I'm, we're talking about it. Oh, is that TENS machine? No, it's not a TENS machine, but that's what like folks assume a PT is going to put a TENS machine on them, which is just a pain blocker, which we don't use in my clinic, but we want to do like, let's make some changes, let's do some healing kind of thing. And so I really am trying to, all of our PTs are trained in this. We do it with all of our patients just as an adjunct. So pelvic floor patient with history of trauma, or it doesn't have to be a pelvic floor person. Everybody has some trauma, but so while they're having therapy there, we're running these protocols to address the nervous system and make the changes. And I want everybody to do this. Shannon is just starting to enter into the PT world as far as teaching classes. So I'm hoping that's going to be upcoming. She was in, can't remember where, it was a few hours away. When she came to do private class last summer, she was doing this big class at this PT clinic, and they were so hungry for it. Oh my gosh, this is going to make such amazing changes in our patients. So I think more PTs are learning about all the other cool things that could be a part of our practice that could kind of help people along a little more quickly and address some of the layers. I want them all to know about it. So whatever that looks like in my future, I already told Shannon, I was like, okay, when I retire down the line, if you need another instructor to go to PT clinics and tell them all the amazing things that you've taught us, let's chat. But so I'm kind of hoping that this is a just a gateway into more in the PT world, more things that we can do besides exercise. And we're all great about patient education and oh, don't lift that way, or sleep in this position. We do a lot of education like that. Oh, your neck hurts. Well, when you get out of bed, roll on your left side first, sit up sideways, don't activate your SCMs. We have a lot of time to work on all that stuff with clients typically. But I just I feel like there's more, and like I said in the beginning, the more I learn, the less I know. So I'm getting ready to fly out and take Shannon's trauma class that she's doing in Delaware next month. That's the protocol specific for various traumas that folks have been through. And I'm that could be why I'm not a pelvic floor therapist, I'm more orthopedic, but that could be why some folks get stuck, muscles have memory, we hear, and people hold, we keep dry needling upper traps, and then people hold their tension and stress up here, and which can cause headaches, and like just looking at the whole connection, like, okay, let's step back a little bit and let's see why is your, and I'm not a counselor, and I'm not going to try to be. I actually have a counselor that I've got coming in the clinic hopefully in April. We're teaming up for some of these trauma folks or whatever, because we see the physical manifestations of it. So we're treating my back hurts, I have constant migraine headaches or whatever because of all of this other stuff. So that's why I think it's so important for us to like team up like different healthcare professionals, because like we all can have our part in a client like that. And I just like, I kind of get excited about like all the could be's, and I'm just, it's sad. And I just went to a conference at the Broadmoor a couple months ago, the Graham sessions for the American Physical Therapy Association. It was like the think tank or folks or whatever. So some of the top folks, and like just talking about like the changes in the profession, how we're like battling for that time with patients, but like every year that Medicare drops for us, because PTs, like I feel like in the chiropractor world, not tell me if I'm wrong, patients will pay cash for that. Patients will buy programs, and they will pay cash and not blink. Yes. In the PT world, it's expected to use insurance. Now, I know there's some great cash-based PT clinics, and I'm seeing this pop up. That was not a thing 20 years ago. Like, we would never think about going outside of insurance and actually having more time with clients and doing cash-based and an hour? You can come in and see me for an hour. Like, that was never even a consideration. So I think that is a result of, the insurance really running what our profession can do, which is kind of heartbreaking.
It is.
And so that's just and that was one of the big conversations, like, like we keep appealing things in court and we're fighting for it, and, like we want to be the musculoskeletal, like experts, like you pull your back out, like what are they going to do in the emergency room when you go in there? They're going to drag you up and say, okay, go see your doctor, your PT next week or whatever. And like, what if they could come see us? And the problem is PT clinics are like, 9 to 6, 8 to 7 or whatever. Like, but they did talk, that was one of the conversations, like what if that can change a little bit? And we're like, the first line of when you pull your back out, like, and you're having muscle spasms, why don't you come do a PT visit? And then you probably will leave feeling better and understand why. First of all, that's what we do. We investigate, why are you having this pain? We're not just gonna like Band-Aid it or whatever. But so, yes, I get a little sad about how it's changed over the years with it's really hard to be a private practice clinic and make it. Like we'll just barely make it kind of thing. It's not going to be, a money maker. We're doing it because we love people. We want to help. We want to make a change. We want to have an environment where our PTs don't feel burned out. You know what I mean? So we're fighting for that. That part makes me sad, but then I also get excited about the changes that I see as far as PTs taking a stand saying, I'm not going to work for a place like that. I think I deserve better. I have training and I deserve to utilize that training, the way it was meant to be, not just to count exercises off or put a hot pack on somebody. I need to have my hands on somebody. That is my passion, why I went into PT. And, they're taking a stand like, you know what, I'm not going to take insurance anymore. I'm going to do cash pay. I'm going to see a patient as long as if I feel like I need to work on them for an hour and 15 minutes, like I have that ability to do that because I can control what their care is. So we're definitely starting to see some of that. I struggle myself with, like, I want insurance, folks who want to use their insurance to have access with their insurance.
Sure.
And we're a big military community. Military wants to use their TRICARE.
Totally.
VA people want to use their VA benefits.
Absolutely.
Yes, and so like that's who we take. We take all the federal insurances, and we do some cash pay stuff for the microcurrent stuff. We do some for dry needling, and
so you have like a hybrid type of setup.
Yeah.
That's cool.
But
that's cool.
But yeah, so it's going to be interesting. Stanley Paris was at the Grand Session, so he's like 90-something years old, and he was the guy out learned all the manual therapy stuff, St. Augustine. And so they talked to him about changes in PT over all the decades that he's been in practice, and it just was really interesting to like hear his take, someone who's experienced all of that. And I feel like we're definitely moving in the right direction in some ways, because like I clearly remember early in my career, we could not touch a patient unless a doctor gave us a prescription that said, you can have physical therapy.
Oh, wow.
And I want you to do ultrasound. I want you to do blah, blah, blah. And we had to follow that. And even if like we wanted to do other things, we have to get permission. And so I think Colorado is like one of the leading states with direct access. I'm from Virginia, so I know they have like, it's morphed over the years. Okay, you can see someone for 2 weeks before a doctor's prescription. Okay, you can see someone 2 months before a doctor's prescription. And so Colorado, it's just like it's direct access. Like you can, now insurance sometimes requires you to have a referral or whatever, but so, and that was one of the things that he talked about. Like it was more doctor-directed care in the beginning. Like you had to wait on a doctor to refer a patient over, and then you needed to do what they said. And now folks can come in off the street and, oh my gosh, I heard this. Can you look at this kind of thing? And so we have that autonomy. And
that sounds like a good direction to me.
Yes. So that is a huge positive in my profession over the years. And, like I think the hopes are that, like folks, instead of going to the emergency room, like they will be able to, PT clinics will start having open hours, like you can walk in kind of thing. Because right now it's always on a schedule, like, oh, you need to be here at 9:15, this is your time or whatever. So excited to see like how that's going to change. I probably have 10 to 15 years left in me, so I'm hoping I'll see some of that while I'm still practicing.
Nice.
But yeah, it's been interesting to be in the profession this long. Not as long as Stanley Paris, but just to like in my 30 years, just to see the changes and where we're moving to, and that I feel like more clinics are becoming more holistic and more emphasis on manual therapy, putting your hands on the patient kind of thing. So it's been fun.
Yeah, cool. Yeah. The cash-based situation is, you're right that it is more common, it's quite common in the chiropractic world. One thing that I will give you guys credit for is that I'm hearing a lot of emphasis on more time. And in the chiropractic world, there's usually, sometimes there is, but usually there's not that emphasis on more time. Most chiropractic experiences last 3 to 5 minutes. That's kind of like the typical average.
You guys work your butts off though, like how?
Well, it's in those types of situations, it tends to be very focused on spinal work.
Right.
It's like, okay, if I can, the way chiropractor would say it, if I can clear out your spine of interference, and it only takes me 5 minutes to do so, then, why would I spend any more time?
Right.
I can go on to the next person and clear out their, neurospinal system, and then I can just continue. And I think that makes the cash-based system more accessible. As opposed to if they had to pay an hour and then we're only able to see 8 people a day.
100%.
Then it would be more challenging, I think, for us to follow that.
And I know some patients love, like, I can pop into my chiropractors and like get this adjusted and get everything aligned, and then I'm good to go. I don't have to go be with my PT for 45 minutes and talk about all the stuff. And
sure.
They're not gonna tell me I'm still breathing terrible and
Sure. And I mean, I think there's pros and cons to that. I see the for the chiros who work in these short time windows, like I can I can appreciate that to some degree, you know, and I see that it works. That's another thing, you know, because like if I watched it happen and if I watched that it didn't have that much benefit, then I'd be like, come on, guys, you know. But I don't see that. I see that it actually surprisingly works quite well, you know, to just do a little spinal body work, and then all of a sudden, like, you know, oh, this shoulder thing is just, how did the shoulder thing go away? If you just worked on my neck and upper back, how did my shoulder thing? Because it's all connected, exactly. So anyway, yeah, something like that. So what kind of, when we were chatting before this to prepare for this, you said you have some stories. I'm curious to ask about some stories. What are some, maybe if you have some fun stories, I'd like to hear that too, but more specifically, I'd like to hear maybe like some success stories, like maybe how about this? Let me make the question a little more dialed in. So what are some typical things that you see as like bread and butter, easy peasy, like I have high confidence that I can help you with this? And then maybe what are some, two-part question, and then maybe the second part would be, what are some things that are stuff that people wouldn't expect a PT to be able to help with, that you're able to help with anyway?
So I feel in general, PTs are pretty confident that we can help anything that walks through the door, because like we get the training on all the things, and if it's joint or muscle related, like we got you. PTs, and I don't know if this is, now I know there's like some upper cervical chiropractors, like I know there is some specialization in chiropractic.
Yes, there is.
And PTs, there's a lot. And so like that's what's so fun about building a team where everybody kind of has their specialty, so we can plug patients in. Oh, you need to see this PT, you need to see that PT. So I feel like folks that walk in the door, like we typically feel like we're going to be able to make some kind of change. And I think across the board, all PTs feel pretty confident. Like we can put our hands on you and we're going to make some changes. Folks that we maybe have more challenge with are like chronic multiple trauma. Like there's other things that are driving the physical stuff that has to be addressed. And so those folks can be, you know, a little bit more of a challenge. And as we see them over a couple of visits, we just start to think, okay, like, do I need to pull somebody else in? Like, do I need to refer them out to somebody to address this part? And maybe take a couple weeks break and then come back and see where we're at, or, you know, just kind of looking at what, and a lot of these folks have been around the block, and when they come in with chronic years of pain and trauma stuff, like they've seen the chiropractor, the acupuncturist, the massage therapist, the counselor, like all the things. And so, you know, just really kind of working through that and like, you know, what's going to be the most beneficial for them. One thing so my husband is military, retired now. So when we were stationed in El Salvador for a year, there just was no PT there. And so I would treat a couple of like the embassy folks or whatever. We were only there for a year, so it wasn't that long. And then we were in DC for like 6 years or so, and then Dominican Republic for 2 years, sorry. And so that is a island that is generally impoverished. Like you have your rich people, and then you have the very poor, and there's just nothing in between. And there is a PT school there. See, I thought I was going to go and get 2 years of like beach relaxation time. And I came, and the doctor at the Embassy Health Clinic was like, can you set up in the storage room in the back of the Embassy Clinic and like see some folks, because like we've sent them out to PT in the community and it has not been good. And just like the it just was an eye-opener, the resources that we have in the United States. And so they have a PT school there, and one of my professors, I went to Old Dominion University for PT school for my master's in Virginia, was like flying students, like with students to almost kind of do like an internship kind of thing, but an experience in a developing world country. Like, this is what PT looks like. This is what we can come teach them and help. So I got to connect with her every time she came, which was pretty cool. But night school bachelor's program is what they had compared to the doctorate program in the U.S. And so basically what they learned was modalities. So they had our old ultrasound machines to do like the heat ultrasound modalities. And, you know, they had a couple like jerry-rigged TENS machines with duct tape on it. And like, you know, they would like, US would donate stuff over, so they kind of got the seconds of things. And it was like very much exercise based. They didn't really learn about the manual therapy or like touching people. And so I volunteered at an orphanage there for disabled kiddos. This is where my stories come in. Sorry if I just went off on a tangent.
It's all good.
So I volunteered, like I had the pediatric experience. So I did see patients at the clinic, but I also I'm like, we're here for 2 years. Like I want to like do something like that makes a difference kind of thing. And so I volunteered at an orphanage for disabled kiddos, and boy, was that an eye-opener for me on so many levels. Like, these were all kids that were premature, cerebral palsy, like moms had no prenatal care and had their baby out in the country, like just somebody delivered it and realized something was wrong with it, so they dumped it at the orphanage because they didn't have resources. There was no like, oh, your kid can go in a Head Start. There's no Head Start there. Or your kid can have all these therapies. There was no therapies there. And so that was shocking to me to realize, like, wow, here's a country that just, and it's not a third world country, it's developing, so they're on their way up, but my gosh, like, just the basics. And, you know, and I remember back when I was in El Salvador, they couldn't afford paper towels, and I was in an orphanage there too. They couldn't afford soap and paper towels for the PTs to wash their hands in between patients, and so they just had these dirty rags. And you know, and the PT, I felt kind of bad because I clearly remember the PTs there. They must have had a PT school in El Salvador. I think you went in and you got PT and OT, so you could do both. And you know, they were asking about salaries and stuff in the U.S., which in the U.S. we think, oh, we don't like, for what we do, we don't get paid great. They get like $120 a month there. Like that was, you know, that was a great salary. If you were like in neurology, you might get $160 a month. Yeah. And so, again, some things that shaped me, you know, along my physical therapy journey. And so, so I had 3 years practicing in a third world and developing countries, and just like the least little thing that you did for them was so appreciated. Like I literally was, because in our 1 year in El Salvador, 6 of it was traveling for my husband's job. We didn't have kids then, so I got to go to all the places. 6 months of it I was there to like work in the orphanage, and you know, just like when I told them we were moving, like they did this big presentation and gave me all these t-shirts and like the certificate of appreciation, and I was like, I didn't even do that much. And they're like, oh my gosh, like you brought paper towels and soap to us. And I'm like, how can I continue to get the paper towels and soap to you? Like, so, you know, when I remember when we got back to the US, I'm really excited. I'm back to Starbucks because there's no Starbucks over there. There is now in El Salvador, but so I'm like, oh, praise Jesus, Starbucks, I'm so excited. And I'm in line, and it's just like our first week back. And like somebody in front of me is like yelling at the barista, like, I told you 4 pumps, and this is not extra hot. And I'm like,
no. Oh,
like, wow,
what
like
a
this
contrast.
really puts things in perspective for me. And like, I just never want to complain again. Not that that happened. I've complained, but it just makes you just like, you know, in the healthcare world especially, like, oh my gosh, we are so flippin' blessed.
Yes.
All of the resources, like, you know, the folks that can use insurance and have insurance, because they don't have that in those countries. There's no insurance. You go to the well, unless you're super rich and you can afford a private insurance in the private hospital, but most folks, just stumble in and wait for, 10 hours in an emergency room to maybe get some Tylenol or whatever. So it was an eye-opener in the healthcare profession, especially, and just some of the experiences I had there, like had to get an MRI for my DIP joint that was inflamed, and it took 3 goes, because their one machine kept breaking down, and
oh wow.
And after 45 minutes of me laying with my arm like this in the MRI machine where they're trying to get the end of it, and then they call me and tell me, oh, it didn't get a good picture, can you come back? And I'm like, oh my gosh, we just have so many blessings in the US, and it just made me kind of appreciative, for what we have and what we can do with that, and that we have these beautiful clinics that we can work out of, and that the ability to touch patients, and
yes,
so.
Yeah, that's beautiful. And I think that travel in general is so helpful for this kind of opening up the tunnel vision that we develop.
Yes.
I think especially as people living in the United States, with definitely a level of privilege, and blessing. And I think traveling outside of this place is mission critical to sort of not yell at the barista for doing 3 pumps instead of 4 pumps or whatever it is. Come on, people,
For
so
sure.
yeah, so that's great that you had those experiences. I hope more people do, and I hope more for myself as well. I've done quite a lot of traveling to some crazy places, but anyway, yeah. So
just makes you more appreciative.
Yes, totally.
I know there's lots of folks in this day and age that complain about all the things about the U.S., but I'm like, gosh, just go somewhere else for a while.
That's right.
And then come back, and then
That's
just
right.
see if maybe you might think differently about that.
That's right. Yeah. Maybe this isn't the best place, but also
Right.
compared to all of the other places, we're towards the top.
I know,
We are
for
towards
sure.
the top of accessibility and I don't know, for lack of a better term, blessings.
Yeah.
We're really towards the top, and you wouldn't know that if you didn't go to these places to see this with your own eyes.
It's true.
So,
We had bars on our windows and big walls and razor wire and stuff when we were living in those 2 places. And I remember coming back to the U.S. and I couldn't sleep for months because I'm like, anybody could get in that window right there. Would I even hear them? And we need alarm systems. Where's the guard at? But yeah, just I don't know, just I know anxiety is huge in our society, but I'm there's so many things we don't have to worry about on the other hand too.
That's right. Yeah, that's right. So in these places that you've been able to work, whether it's here in your office here locally or abroad, maybe, so I guess I want to get back to stuff that PTs can help with, I suppose.
Yeah.
So it sounds like musculoskeletal issues you're confident that you can take care of, neck pain, back pain, shoulder pain, knee pain, this kind of
plantar
fasciitis, these kinds of things are bread and butter, easy peasy. You can fix that kind of stuff. And then what about in the pediatric population? Because you mentioned many times that pediatrics is a big passion for you. And this is a question I get as a pediatric chiropractor. Why do babies need to get worked on? They're brand new.
Yeah.
What's up with that? So how do you answer? I have my answers for those questions, but I'm curious on yours. How do you?
So in PT, in pediatrics, what we do is pediatric PTs is 100% different than what you do as a pediatric chiropractor. We are not mobilizing, and we're not doing any of that stuff typically. It's more developmental stuff. And so premature baby, is delayed in motor skills or whatever, comes to PT and should be crawling, but they're just kind of laying there, or they can't roll over or whatever. And so this is my experience, with pediatric PT. So it was, really working through what is the pattern we need to teach this kid's system to roll over, get on all fours, move into, kneeling, tall kneel, half kneel, up to stand. So it was more movement, functional stuff. Yes, we did have kids. And this is where I was saying I wish I had known some of the things back then, but we had kids with cerebral palsy. It was pretty common. So your toe walkers and stuff, and like they're Botoxing the heck out of the calf, and then they would cast them and try to get force them into neutral. So these kids would come out of a cast and have like no muscle strength or balance or whatever, and yes, we stretched the crap out of the muscle, but we didn't touch the talus and work on posterior glides needed for dorsiflexion. I didn't have the manual skills back then, and I don't, and maybe that's different now with pediatric PTs. I just, felt like if I had have known some of that stuff, it would have been a little more beneficial with, the kids that were trying to get their heels on the ground to walk or whatever. So there is some manual therapy component to that, but generally a pediatric physical therapist is working on motor skills and working on hey, let's get the trunk to kick in on a therapy ball because they can't sit by themselves. We've got to strengthen this. And they're so flexed, there's no extensor muscles kicking in. Let's, go prone on a ball and work on strengthening. Let's work on head control. Whereas you guys are more addressing the system. Hey, this kid might have had a traumatic birth experience, and, sutures aren't moving like they should. And this is just my take on what you're doing.
Sure.
And, I know you guys, are able to help with reflex and colic, and we don't know how to do any of that stuff.
I see.
Yeah.
I see. So before I say that, actually, maybe I'll just on what you just said just right now, what is it that we're doing? And actually what we're doing is very little big movements,
right.
Almost no big movements at all. It's all very, very subtle, very soft touch. And the way I sort of take that is more as giving baby or child some proprioceptive feedback, and kind of interfacing with the nervous system, just to sort of say, hello, wake up, here you are, and this is kind of, and that's all it is. It's just like that, maybe all just a little bit, but not really, it's like the amount of pressure that it would take to press into a ripe tomato, without bruising it.
Yeah.
Just super, super gentle, and just that little bit of focused and intelligent attention, with just very light pressure, and it's like a miracle. I don't know. And then the colic goes away. What? That's crazy. I feel like I didn't even do anything. And sometimes the parents say, you didn't even do anything, well, you just come back next week and let me know.
Yeah.
And then the mom comes back next week and they're like, oh my God, for the first time, I had this feedback just a couple weeks ago. For the first time in the baby's 2 months of life, baby stopped crying,
That's
and the digestion improved.
Yeah.
And it didn't look like you did anything.
Yeah.
So it's just super subtle, very gentle work. And the way I take that on a physical level, because we can take it in a spiritual level and an energetic level and all of this, but just to address purely the physical level, the way I kind of understand it is as proprioceptive feedback and a neural reset, nervous system reset into that little baby system or into the child system, So that's...
I've probably just been through some traumatic things,
Yeah, or maybe there's something, in the case of some colic or digestive problems, maybe there's some kind of fascial bundling, and you just kind of just very simple, just kind of move it around a little bit, kind of make it juicy again wherever maybe some fascial layers are a little kind of wanting to be wound up or stuck together. You just kind of introduce a little bit of attention into those layers, and then all of a sudden it opens it up again, and then something like that.
I wish my mom had known about pediatric chiropractic. She knew about chiropractic for herself, which is what got me interested in PT. So she ruptured discs and spine stuff and migraines, and I was pretty little, and she'd be debilitated in a dark room or down with her back. And she was young. She's only 20 years older than me. She was young, 22 years older. But I remember she'd come home and show me what the chiropractor did, and then asked me, like, you think you can just push here, whatever? But I got this. I'm like 7 years old.
That's awesome.
I got this and stuff. I just thought it was the coolest thing that I could put my hands on somebody, and like that piqued my interest in. Well, look at that! Like that little thing I did. Like my mom can now get out of bed and like make me food now, so I'm gonna do that more often.
Yeah, so it's helpful. Your little 7-year-old hands.
Yeah, so it tells you it doesn't
awesome.
take a lot of like heavy duty like pressure in therapy to make changes in the
right.
nervous system. But I was born torticollis, and like nobody knew what to do with that. And I mean, I still like I just never was addressed. And the doctor was like, "Oh, just put a box here and turn the crib, whatever, so she doesn't turn to the right anymore where her torticollis is pulling her, and eventually she'll look that way or whatever." But so I definitely see huge benefits of getting PT and chiropractor and stuff like that at a young age, even massage.
Totally.
Yeah.
So what's kind of the youngest age that you're working with? Like 3, 4, 5,
So
maybe?
my clinic is not set up for the pediatric clients that I treated early in my career, which is more neurological stuff.
Okay.
So I do more adult manual therapy now, and then if I get kiddos, it's orthopedic stuff.
Got it.
I did, when I first opened, try to like bring some of the like torticollis kids and some of the special needs kids into the clinic, but like if somebody's screaming and hollering and somebody's next door, getting PT for a migraine, like we weren't set up for peds. And I like when I moved here in the late 1900s to work at Memorial Hospital in pediatrics, oh my gosh, we had like a dream clinic over on Printers Parkway, and they built it new while I was there, and we had speech, PT, OT, and we had like a trampoline floor and like a foam pit, and we had a sensory area where you could like play with shaving cream and like rinse the kid down, and like Barney songs in the background, and like it was just a giant play fest. That was for PT, like that was a pretty fun, like kids just thought, I'm going to play at this awesome place kind of thing. So that was fun. I really enjoyed those years, but you have to be set up for it. And since we're more of an adult manual therapy, pelvic floor type of clinic that's more calm and quiet.
Totally.
We don't really see the kids with neurological stuff anymore, even though I will always like have a love for those types of kiddos and all the great interactions that I had. But yeah, so now for kiddos, it's more like athletic injuries or like
pre-teen.
Yeah, or we see a lot more neck and headache stuff because of kids, and tech neck and all that stuff. We're seeing that younger and younger with, like kids that'll be on their elbows with their pad and cervical extension for hours, and then, with pain. So,
or this posture.
I know, totally.
I see this posture a lot in the kids in the office.
I was in this was a couple years ago in a hair salon, barber. It was for guys mostly. So I have 2 boys, so I was taking one of my kids, and I walk in, and PTs can't help ourselves. Yes, we're judging everybody, but we're assessing like, oh, look at that person walk in, they must have a hip issue because they don't have hip extension. We can't help it. We're always like analyzing or whatever. Oh man, I should pass him a card over. I could help him, but anyway, but we don't. But so I look down the row, and it's like 6, 7 kids waiting for their haircuts, and every one of them pad or phone.
Yes.
And I was like, oh my gosh, where are we going to be in 10, 15 years, with
it's a good
with
question.
this? Yeah, because I fight it with my kids are teens now, and I know they're sick of me. But and I've taken them to chiropractic because they won't let me touch them. My 16-year-old had a neck thing, and I'm his mom. He didn't want me to mess with him.
Sure.
But anyway, so yeah, it's that was interesting to like all the way down the line just to look and see that, and like parents are with them, but they just weren't attuned to it.
They're not, and that's right. That's right. Yeah, maybe they're kind of like pleased that they're not making a scene. And
I know,
like, okay,
I think
you just
so.
focus on that
Yeah.
screen, and
Yeah.
which I don't know about that, but
I know. But yeah, so I think, we're probably starting to see some kids like that were, are mostly neurologically intact, but now having some things from the postural distortions.
yes,
So,
yes.
I took, I don't know if you ever heard of American Posture Institute. It's a chiropractic group.
No.
I've taken a few classes like ocular neuro rehab and ergonomics or whatever with them. And so the ergonomics class, I was like, oh, this is going to be boring. It's like, oh, this is how you sit at your desk at 90 degrees. And it was like more of the neurology of what sitting at a desk at a computer in an office does to like your brain and your visual system, and then everything follows. Like when you're affecting this, like it affects everything. It was fascinating.
Very cool.
Yeah.
Very, very cool. Very cool. Very cool. Okay, so in this particular office that you're in now, maybe like preteen, teen, but like maybe in general, what's like if you were going back to the beginning of your career, or like maybe someone who's like, this is a pediatric PT clinic. What's the youngest that that PTs are able to see?
Like straight out of the womb,
Like
and
one day.
out of the year. Yeah, pretty much right after birth. And so like I worked and there's lots of PTs that do this, and I think it's so cool in the NICU because I worked in inpatient for a little bit. And so like we are just kind of assessing developmental issues just based on kind of like feeling muscle tone and trying not to stress the preemie baby out, and working on positioning, like they don't have their flexor tone, and so okay, mom or dad, let's roll a little blankie up and like let's support and let's get their hands to their mouth for self-calming and soothing. And so like from right away we can start with interventions like that, and just showing parents at home, like until the flexor muscles start to kick in. Like your kid was born 2 months early, so it's going to take 2 months after they're born. They're going to be behind for a little bit, but these are things you can do to promote, proper alignment and posture, and like to help the nervous system calm itself, which is super important early on, because it's a stressful thing when, a baby is a couple months early and they're in this environment with bright lights and people poking at them and stuff. And then like, just from then on, like parents will bring kids in, once they start to notice developmental delays, like my kid should be holding their head up by themselves at this point, right? And they're not lifting their head up at all, and they're a few months old. And
so how would you address that?
Playing. Yeah. So like getting the kid like bright lights and toys, and like, if the kid's nervous system can take it, but just something that, you can interest the kid in. So like usually pediatric clinics like have all the fun things, all the developmental toys. And, like if a kid, for example, like can't sit on their own and they're, like 11 months old sitting in like a, what do you call those? My kid can never fit in it because his legs are too fat, but the bumbo chairs or whatever, you can sit, get pretty young kids in that kind of supports them. They're like rubbery.
Yes.
Not
a fan of those, by the way.
Yeah, I agree.
Good.
That's
good.
Yeah, and they're like, if when we got to a restaurant, they can't sit, they're 10 months old, but they can't sit like, in anything but this bumbo chair or whatever to support them, then we would be on the floor, like controlling the pelvis and activating the abdominals and stimulating the erectors, and have toys where they're like reaching and challenging their balance and getting them out of W sit, which is how young kids get stability when they don't have great, muscle tone yet. That like W sit that can affect your hip growth and your knees and all that stuff. And so, so those were, and back in the day, I don't know how it is now with insurance. We had hour visits with kids. And so like we'd be like go in different rooms and do different things. And it just was literally, they never knew they were working necessarily. Like
nice.
We'd have them up in elbow prop and a toy over here. We're trying to work on commando crawling a little bit, and hey, let's go get this toy over here, and we're just kind of manually like facilitating stuff. So it was fun.
That does sound like fun. Yeah, that's.
And we'd see kiddos, for years. And I remember when I was at Memorial for 2 years, and when I was getting married and moving to Fort Hood, Texas, like I knew these families, like I was like a part of their family. I remember one little girl wrote my soon-to-be husband like a nasty note about ripping me out of her life and how dare he and whatever. So that was a tough move, because you really like become family to these folks. You see these kids growing, and I even ran into a kiddo that I saw back. It made me feel a little old back in the Memorial days, where premature birth and all that stuff, and I saw them like 20 some years later, 25 years later or whatever, around town, and I was like,
whoa,
wow, like that's like, it's fascinating to see though, like all those years later, like, how are you? And how, kind of thing. But it made me feel old too, though, because I was like, gosh, that seemed like it was like 5 years ago, but.
Yeah, that's fun. Okay, so I have a question about any like dramatic stories that pop into mind of like, this person came with this crazy thing, and then I did my practice, and then they kind of like got better. You had any kind of fun dramatic stories pop into mind?
Well, as a chiropractor, anytime you're messing with the spine, especially the neck, like that can just rock people's world in a good way. So yeah, I feel like I have a gazillion stories. One that pops out is an older fellow that obviously had like some like spinal changes with posture and arthritis and all that stuff, and he was just so miserable, and like you ask him a question and it was this, and like he just couldn't drive well because it was like hard to turn and see, and and then sometimes folks will like have chronic headaches from all the neck stuff or whatever, and I feel like upper cervical stuff is a little more PT specialized. Like you don't get that in school as much necessarily. You have to go and take all the cervical classes, and so not everybody does that. And so I think I went into more being a cervical specialist because I had a drunk driver hit me when I was like in my late 20s. I was stopped and he just slammed into me, and that started my neck stuff. And I could not get any relief. And I went to chiropractor, and I saw PT, and I saw massage therapy. And so I was like, okay, like there has to be like more to this treatment. Like, let's get this figured out. But anyway, so just working on, starting off first with it, we're going to do the nervous system first. So shoe points, which are down the spine, a finger over from the SPs. Those are the acupuncture points for the spine there. So hitting those with the microcurrent, and then just getting in there with some upper cervical stuff, which you probably hadn't had before, I'm guessing. And anyway, when he sat up, like he was like, oh my gosh, like, okay, not like that extreme, but
nice.
Yeah. And we see like I feel like with neck patients, we see that a lot. One of my PTs the other day, I love to mentor some of the younger PTs, so we'd been working on some upper cervical stuff, and so she was like really excited to try it on everybody. And so she had a patient come out, and I was at the front desk hanging out, and he was like, oh my gosh. And I was like, tell me. And he was like, oh my gosh, gosh, my PT, like I have never like turned my head or felt this good in like, it's been 15 years. Like I just want to cry. And she literally like 45-minute session, he had done her nervous system stuff, worked on upper cervical, dry needle SEMs because, you know, he's in the healthcare profession. He's down here with people, working down here with patients or whatever. So did dry needling on the SEMs and some of the upper cervical stuff. And so we get that a lot. Like, you know, I feel like that's why it's kind of fun just hanging out when I'm not having patients, just to kind of interact with the clients and catch up and hear the reactions when people come out of the room. But yeah, like we get a lot of that. Like 2 weeks, you know, and here's a cool one with the nervous system. I had a person in a very high stress bank job that came in. I was working on a bank loan for my business, and so he just happened to, you know, was talking about PT or whatever, and he was like, yeah, he's like, I had this tumor removed up here, and I have all this scar tissue, and it like just bothers me. And he said, and I was like, oh, we do scar stuff. Come on in, let's just take a peek or whatever. And so we started with that. This is often how it unfolds with PT. You come in for one thing. And then he started talking about, I can't sleep. I get no sleep. He said, a lot of times I go to sleep before my wife gets home, and then when I hear the garage door go up, that's it for me for the night. Like I cannot fall asleep. I feel like I haven't gotten deep sleep. It's affecting like so many things. And so he came in and we did scar release with the microcurrent. So got all of this tissue like unadhered, worked on some cervical stuff. And then I was like, let's do some of the microcurrent fun with the vagus nerve. So we started doing vagus nerve stimulation using microcurrent. Released diaphragm, worked on breathing patterns, worked on, have you ever read the book Breath by James Nestor?
I have heard so much about this book.
It was like changed everything. Yeah. And I realized what a horrible breather I was. But anyway, started talking to him about, okay, like, let's talk about your breathing pattern, because like a lot of times on Apple Watches now, you can like see like, oh, I breathe 24 times a minute or whatever. It should be like 5 or 6, but you can kind of track that. And so nobody knows about that unless you read the book or like work with a breath worker. Like nobody knows that stuff. But we all breathe pretty inefficiently. And I was finding that I was having apnea during the day. Like I was breathing so shallow, I'd be like, it's like, oh my gosh, I'm not even asleep. Like, what is up? So anyway, so we started like working on all the things. And that's what I love about PT. It's not just like, we're just doing this one thing. It's like, let's see what you know, the shoulder's connected to the neck, like everything. And so it literally took, I don't know, 2, 3 visits, and he came back in and he was like, okay, I sleep through the night now.
Wow.
Like, and I said, okay, so you might need to do a reset if you get like a virus, because like viruses and COVID and stuff can affect the vagus nerve and stress. So like he had a high stress job. So here are the tools for you to work on this. You can stimulate your vagus nerve yourself by doing this, this, and this, humming, you know, breathing slower, not deeper, but just breathing slower, all the things. And so like he took the tools, and like I worked on a couple things, maybe twice, but I never had to see him again. He was like good to go. And I'm just like, just that little tweak, like, you know, it just sometimes doesn't take much, but that just like makes me smile, you know, grin ear to ear when I hear stories like that. And in a PT, we get a lot of that because like we spend, you know, a couple months seeing patients once or twice, usually once a week, sometimes twice a week. We'll spend a few months, and like some of our veterans that have many issues, they'll stay with us on and off for different issues for a year or 2. And so you just really like get to learn about them and like how they respond to, you know, various things that we do. And yeah, it's fun. So we get success stories like on a daily basis. And last staff meeting, or maybe the one before, I like to read the success stories to the PTs, like just as a reinforcement, and we send questionnaires out and patients will rate us and tell us why, so I'll read that. And then I said, let's just do like a peak of the week, like just like what was something amazing, like, you know, this week, like an interaction with the patient or another, you know, staff member. And like everybody kind of like big smiles as we went around, and they just, oh my gosh, this one patient that like couldn't do this last week and she came in and she was so excited. And I was like, this is why we do what we do. Like this makes it so worthwhile just to hear this. So yeah.
Beautiful. Yeah, very good. Okay, I'd like to run something by you from the chiropractic world. And then you tell me what you think about it. If you maybe if you guys think about it in a similar way or maybe a little bit of a different way. But okay, so first, actually, before I get into that, I have to give just a little bit of context. There's sort of, I don't know if I can split it really right down the middle, really, but more or less there's a little bit of a divergence within the chiropractic world, and one side of it I would call maybe more, how do I say, maybe a little bit more mechanistic, maybe a little bit more Western sort of like oriented, wanting to maybe integrate a little bit more with the medical profession. And then another sort of way of thinking about chiropractic, which maybe we could call a more vitalistic perspective. And it depends on where you go to school, mm-hmm. that you're going to get one or the other education, and you're probably going to get a little bit of both in any school, and maybe the ratios will vary. But the school that I went to, and the reason I chose that school, is they're very proud of being in the vitalistic camp, mm-hmm. very, very vitalistic camp. So from the vitalists' perspective, they would say something like, what we focus on is that there's an innate intelligence that is within our bodies, a spiritual force, if you will, and that spiritual force is animating our bodies and providing an environment where it's a coordinated and smart system where it heals itself, it runs itself, and there's just like this spirit force within us, and it just wants to go. And if there's an interference somehow within that system, whether it's a physical interference, a chemical interference, or an emotional interference, all we got to do is take those interferences away, and then that spirit force can manifest, and that spirit force can act on our body, and that's what makes us healthy. And so the vitalistic chiropractors would say something like, our focus of our work is to release any interference so that the body's innate intelligence can work. And so it's this like philosophically oriented type of care. That's how a vitalistic chiropractor would describe their work. So when I say all of that, what do you think about all of that, I guess, and is there any overlap within maybe more of a vitalistic PT world, or is there maybe not so much, or does it depend where you go or where you are trained? Or
I think most PTs would say some of that's hippy dippy.
And a lot of chiropractors would say the same thing, by the way.
Yeah. But because we just we don't get any of the energy stuff. Like that's not anything that we learn. What we learn more is almost like the body's a machine, and if you get a screw loose in your shoulder or whatever, these things are going to happen or whatever, and so you have to go in and fix this and then whatever. That was the PT school I went to, and I don't know if things are different now, as I've just had my first new grad, so I'm just hearing some of the things that she learned. And I think we kind of missed the boat a little bit on some of the energetic stuff, but that is very outside of the box of traditional PT. And folks might think my clinic's a little hippy dippy because I've had the acupuncturists and the chiropractors and whatever, and some of the training that we've learned, we learn about, with the microcurrent stuff, we learn about the rivers in the body, which is very not Western medicine at all. It's very Eastern medicine, and we don't get any of that PT school. We don't get any of that in continuing education. That's just not a part of PT. But I think maybe up and coming more and more clinics are starting to open their eyes to more of that, because I see that like the dolphin microcurrent folks, I'm starting to see that in more and more clinics. Like in Virginia, it was bigger because it was taught more in Florida, and so they would just hop over and teach classes. They'll occasionally have classes out this way, but I feel like maybe that's something that's starting to make its way into PT a little bit. Like some of the, like, yes, your body is energetic, and if you have scars or whatever, it's like you have a river, right? And you cut a tree and throw it across the river, what's going to happen? Well, the energy is going to back up here. It's going to change the backflow. It's got to go around this way. Like, it's going to affect things. And so that's why, like, in our clinic, like, scar release is the first thing we look at. Abdominals, especially through the trunk. Like, hey, like, where are your scars at? Let's address these. Let's release these. Let's, because new collagen cells, gotta make sure I can say this right, have a positive polarity versus the cells around them that have a negative polarity. And so it'll stay that way unless you do something. That's just like the physiology of it. And so using the microcurrent stuff, we're able to change the polarity of those new cells to everybody around them. And so the body's not like, oh my gosh, there's a log in the river here or whatever. And so, yes, when I bring new PTs when I bring PTs into the clinic that are new to us, I always worry a little, like when I start to like talk to them about like some of the, like the first thing they learn is the dolphin microcurrent stuff. Like you're gonna start to stimulate some shoe points, you're gonna adjust the nervous system, we're gonna do scars, and sometimes I'm like, they're gonna think I'm totally crazy here. Nobody's told me that they think I'm crazy yet, but that is not at all in any of our training. There is nothing. No matter what school. No, there is nothing spiritual. There is nothing energetic. It is, the body is it's this amazing, beautiful machine, and this is how it functions normally. And when something happens, and something changes, then that's what we're going to address. Just in my experience, like there may be areas around the U.S. where there's more hippy-dippy clinics looking into that stuff. I just really haven't experienced that yet, and I'm hoping, that's maybe something down the line. Maybe something as I'm getting older, I can, maybe start teaching or talking to folks or whatever about, because like I definitely think that's an important part of our body.
Yes. And, regardless of the orientation there, if the work works, then the work works.
Yeah.
And it sounds to me like the work works, so almost you can't really say too much, you guys should be more whatever or less whatever. It's like, well, if you're helping people, then you're helping people. So like,
100%.
You can't say too much, I don't think.
No. And I'm not trying to be negative or down on, the PT profession or certain clinics or whatever, because PT is an amazing, powerful tool, and just the basics that we're taught in PT school, which I think, like I said, is even better now than it used to be. Is life-changing for folks. And I just really think that we know the musculoskeletal system, like that is our wheelhouse, and there's just so many things we can do. And if I had a person that came in that couldn't turn their neck or whatever, like I could make a change just doing one or two little manual therapy. I don't have to do all the other things. Like I can make a change, just like a couple of little things that I've learned or whatever, can make huge changes in that person. So I think all of our tools, like no matter what we're doing, we all have, in PT, there's a lot of specialties. So like there's visceral PTs that will like really work on visceral mobilization, and there's PTs that like specialize more in cranial and craniosacral stuff, and like there's PTs who are more like pelvic floor and like dry needling the pelvic floor and dry this and that, and upper cervical, and like hand therapists and PTs that specialize like from the hips down, and they love to see runners and work on all the things. And so you see a lot of like specializations in PT. That's why like when I meet folks that want to go into PT school, I'm like, you're gonna have so much fun. Like you can do so many things. Like in my experience, I have been, worked in pediatric rehab hospitals. I have done home health. I have done in the school system, in the outpatient PT clinic for pediatrics and adults, and in the NICU and in acute care. And like, you will never be bored. Like there's always, like if you're like, I've done this for, like I did pediatrics for 6 years, and I'm like, okay, I'm in a position where I need to like start to expand a little bit because there's no peds clinics here. And so I'm gonna start learning this, and like, so I just feel like we can always be learning, and we're always adding things to our practice. But just like even the basic PT skills, I think, are extremely powerful. And we're big educators, which, even if we only have 10 or 15 minutes with a patient, we can, as we're working on them, we can, hey, tell me about how you're sleeping. Don't sleep on your stomach. You're going to blah, blah, blah. And, we educate as we go. And I think that's one of our most powerful things, because we want to give patients tools that they feel empowered. Like, oh, I don't have to keep coming back every time this happens. Like, let me try some things on my own, so that they like take more responsibility for their health and for, their habits or whatever have you. So like I kind of, nerd out on like the outside the box PT stuff a little bit, with the scar stuff and the moving energy and the microcurrent stuff and the brain trauma, addressing some of that stuff. And those are just like extra fun things that we can do. But I think, and this town has a lot of great manual therapy clinics. Where I came from, when I was in Virginia, I was at one of the few. And even though we're manual therapy, we were seeing 2 an hour with a tech, and some clinics, see 2 to 3 an hour. And so when I moved here, like the sky was the limit for the manual therapy clinics I could work for. Like I was like, wow, I've just never seen so much hands-on stuff in a town. And like when I moved here 10 years ago, like I didn't dry needle. Like that wasn't a big thing in Virginia. Everybody knew how to dry needle here. I was like, I guess I probably need to go take a class and get on the bandwagon with this and like see what it is. Does this make changes? And
turns out it does.
Yeah, it affects the nervous system.
Right.
But so that's what I love about PT, that there's just like so many things that you can specialize in or do, or like if you have an interest in this, like and you want to see more of these type of patients, then you go for it. Like start taking classes and interfacing with those type of clients, and so it's just really makes it fun. You'll never get bored.
Nice.
I knew from a young age, like I actually went into college as an art major. So I'm very much right-brained, which may have driven me more towards the hippy-dippy stuff. But I came out with a biology degree and then went into PT school. I've always loved the sciences, but I just, I am super passionate about our profession, and I hope we can figure things out logistically with the decrease in insurances, and like how we can survive as a profession, how we can still see folks and let them use their insurance and still like pay the bills and pay the overhead and stuff.
Yes, we want to optimize the care for our people.
Yes, 100%. For sure. Yeah, and this is a really great town for there are so many great manual therapists in this town, PT wise. Like I've never been in a town that had like so many, that it wasn't just like an exercise clinic or what, you know what I mean? So I think we're pretty blessed in this town. Nice. For sure.
I think so too. I've really enjoyed being here and practicing here, and the community is really awesome in general, I think. So okay, how about this? What are some of we mentioned at the very, very beginning that there seems to be some kind of overarching like thing between PTs and chiros. What are the things that PTs say about chiros that are like, what the heck is up with this? What are maybe some typical like objections that PTs have about the chiropractic profession?
So I think in general it's a lack of understanding. Like, I think if we all had chiropractic friends and like we talked more about like what we did, there'd be more of an understanding. But
I agree.
I feel like PTs are a little more standoffish to like relationships with chiropractors. Again, it's, oh, they're in competition and that person's gonna want to go see them and not me or whatever. But I think, like, I hate to say it.
Say it. I want you to be honest.
You know, and there are stories of PTs accidentally injuring and hurting folks, but I think it's just we all think, I shouldn't say we all, but I think there's just this belief that you're going to crack a neck and maybe take the vertebral artery with it, and like there's a chance of somebody being injured. Even though I know that you guys lock things in a certain way to isolate. It's not like you're just grabbing somebody's neck, you know what I mean? Like, you guys know what you're doing. But I think,
for the most part.
Yeah, for most of it. I just think early, like in my career, like that was it. Like, oh, your chiropractor's just gonna grab your neck and manipulate it and then bye, see you later. Come back next week, let's do this again kind of thing.
Those are fair questions or fair objections, I think.
Yeah, and I think because like PTs get the time to do more educational stuff, like I think that some PTs may feel, and I probably was one of these in my younger years before I knew more, but it's just kind of like you're not giving the patient any tools to, you know, like, why don't you try this at home, or why don't you work on this so this doesn't keep happening kind of thing. So yeah. I really think
that's fair.
Yeah.
Yeah. That's all fair. I'd like to address those if you don't mind.
Please, yes. Yeah.
So the neck, the cervical work, freaking people out. The first place that my mind goes to with that is Hollywood, actually, because you see in these Hollywood movies, you see some ninja guy go whoop-ah, and then the person falls dead, and it's like, everybody, it doesn't work like that. You know, that's Hollywood nonsense, and you know that's not how it works. You would have to wrench it so hard, you know, and it's not a poof, you know, like a feather move. That's like, you know, it takes a lot of work actually to break someone's neck with a twist move, you know. So if a chiropractor is doing that, I promise you they will be out of a job quickly. The only reason why our profession has stood the test of time for coming up on 130 years now is because in general, the work is quite safe. And here's a fun for all of you super analytical, maybe like engineer type brains out there, like show me some evidence. Here's a wonderful piece of evidence that I love pointing out to people. That is malpractice insurance rates. What we pay for malpractice insurance. Now, do you think that malpractice insurance carriers are messing around? They're not messing around. They're very on point with their numbers. Yeah. They're numbers people, and they're very precise with their numbers. And so a medical doctor, just to give a little context, a medical doctor's malpractice insurance rates are somewhere in the tens of thousands of dollars. I think maybe roughly something like between 20 and 50 grand a year or something like that is what a typical medical doctor will pay for malpractice insurance. A surgeon pays six figures. If there's a medical doctor who's a surgeon, they pay six figures worth of malpractice insurance. Anesthesiologist is same. It's extraordinary how much they pay for malpractice. And the reason they have to pay so much is because their work is dangerous, you know, and the risk is high, let's just say. So they pay according to that. Does everybody know how much chiropractors pay for malpractice? I pay like $2,000 a year.
Yeah.
If my work was dangerous,
You'd be paying a lot more.
I would be paying a lot more than $2,000 a year. So I love that little bit of evidence to say, like, look, these people aren't messing around. They're going to charge accordingly because they're very on point with their numbers.
Yeah.
And that's what they charge us. It's something between like $1,000 and $3,000 a year. And I'm paying like $2,000. So we can all kind of take a breath and, do accidents happen? Yes, they happen. I have talked with people who have been injured through what I would call a sloppy work, sloppy adjustments.
Right.
Yes, it does happen. But it happens a lot less than people think.
Yeah.
And chiropractors who are worth their salt, people who really care and people who are very careful and listen well, people who are good listeners, chiropractors who are good listeners, not only listeners with their ears, but listeners with their hands. You can listen with your hands and you can listen with your eyes, like looking at the person's face who you're working with, and you can see how it's landing what you're doing.
Right.
You can feel it in your hands, you can feel it in your body, how your work is landing if you're a good listener. So such practitioners, they don't injure people. The work is very safe. So for all of the people who are wondering about our professions, or maybe the PTs who are wondering about my profession, hopefully that kind of helps a little bit. And then as far as the concern of like, oh, it's all passive work and we should be giving people something to do at home, I agree with that criticism, actually. I think that's a fair criticism, I think it would be cool if we could send people home with more homework, or like more suggestions on things that they could do to be improving their life at home. And to our credit, some chiropractors are much better at that than people might think they are. They're like in the office that I'm working at the World of Wellness, and in my own personal practice, and in a lot of the practices that I've been exposed to in my time. You would be surprised at how much at-home suggestions we give to people. Even if it's just a 5-minute visit, like it doesn't take that long to say like, hey, this kind of pillow, think about this when you choose a pillow. Think about this when you sleep. Think about this whenever you lift up your grandchild off the floor. Like it doesn't take that much time, and we do that. So maybe that can...
that's good to hear.
Addressing those concerns. Yeah, something like. And then was there a third one? I don't know if it was those two.
Yeah.
Anyway, so yeah, something
and
like
the
that.
same in the PT world. Like our malpractice is very low, but things do happen, and probably more with like the dry needling stuff. And there's been a couple incidents of pneumothoraxes caused because improper technique and palpation and like not maybe not doing something the way it's taught occur, and then that will scare other people from wanting to have it or wanting to get trained in it. But it is a very teeny
it's very small,
and
yes,
most PTs at dry needle are extremely precautious, what you need to stay away from. You don't send a needle straight towards the lung field kind of thing or whatever. But I think we get a bad rap, just like maybe chiropractors, we think everybody just cracks everybody's neck, and that can be dangerous. Like I think, PTs in the dry needle business, might have some fear from folks based on a couple little incidents that have been documented and occurred, so they get a bad rep for that too. So
yeah. Cool. Yeah, very good. Okay, so
I want you to tell me too, like a little bit about what you guys think about PTs. Like, what do you think we're all just giving people exercises, or like what is a chiropractor view on what a PT does?
Right. Yeah. So I think it depends on the chiropractor. Some chiropractors are very, very favorable towards PTs. I'm one of them. If everybody hasn't noticed, I'm talking to a PT. I have a great respect for the good ones. because I do think that there are good ones, and I do think that you guys do, the good ones do really, really excellent work. And I'm not alone in that. There's a lot of chiropractors who feel that way. The chiropractors who would trash talk the PT profession, they would say, yeah, their criticism would be maybe something along the lines of like, yeah, they're just prescribing exercises according to a protocol without being, very nuanced about it. And maybe an overly mechanistic way of thinking, whereas the body is, maybe there are some aspects of the human body that are kind of mechanistic, but it's more like the other way around, like a real vitalist would say, a machine is like an organism. An organism is not like a machine, right? It's in the opposite direction. And so it's like a philosophical sort of error, I think they would say. Like if the body is a machine, then what's up with something like consciousness or will? There's no consciousness or will in a machine, but we have consciousness and will. So that's an easy way to address like, it's not so machine-like, as maybe people might think. And so those would probably be some of the concerns. And
I do think like, PTs are aware of, the spirituality and all of the other things in the body, but specifically like in PT school, and I don't know if this has changed over the years, it's very much like, this is a concave on convex, this is how this joint moves, these are the muscles, this is what you do to change it kind of thing. And I know plenty of PTs have moved beyond that and kind of, endeavored to learn more about the other things and more, and we're all very holistic. Not holistic, we're all very, what's the word I'm looking for? We know when someone's referred for a shoulder, and I think earlier in my career it was like, you just mobilize the shoulder, that's it, and let's get that going. But I think now PTs do a great job of, okay, like why is the shoulder hurting? Like what's going on down here that might be affecting up here, and like more like looking over the whole body, like what's going on, how's this connected? Like I feel like that's definitely improved over the years with what PTs are doing. It's not just, I'm just seeing you for this one thing. It's let's put out, and insurances, traditionally over the years have kind of driven some of that, like doctor refers you for shoulder pain, okay, you can only touch the shoulder. Yeah, but like I needed to mobilize the neck, we're not paying you for that visit, you touch the neck, you have to, it's the shoulder. So I feel like part of that is, like got driven initially by like insurance rules and stuff, and we had to practice within, the confines of that. And that's what I love about like, the folks that we see that are cash pay. Insurances don't want you working on a foot if somebody's referred for a headache, even though that can be caused. But that's one of the benefits of moving cash pay is like you can look at everything. You can do whatever you want. You don't have to just document, I touched this joint for 20 minutes and then, okay, I just went over here for 30 seconds, but we're not going to count that because I was mostly over here. So I think that's a benefit, and there's some great, cash pay clinics popping up around town, but it does give us more of the freedom to work the way we're intended to work, and not in the confines of you can only do this, the doctor said you can only do that kind of thing. So
that's a criticism better directed towards the insurance companies rather than towards the PTs.
100%.
Yes,
that's 100%.
Definitely. And a lot of chiropractors are caught in that exact same trap. They're caught in the exact same trap. You're only allowed to do these moves and this type of care and in this type of time frame, and it's like, and then we're caught in that trap. The people, for the chiropractors who are engaging in that style of practice. So it is tough, and it's not the PT's fault, it's not the chiropractor's fault, it's the insurance company's fault, actually. So I think from whichever chiropractors or whichever people are going to criticize the PTs because of that, that is an error because you're directing the criticism in the wrong place. And also, I'll also, in defense of PTs even furthermore, I'll kind of like echo a little bit of what I said before. If the work works, then what's your problem?
Right. 100%.
If the work works, then what's the problem here? If you can engage with something from different angles, then why would you not? Oh, because I know that my way is the way. No, you don't. No, you don't. There are multiple ways of engaging with something, and I think I believe that when you hit things from, multiple frames of reference and multiple perspectives, it's going to be better than if you're just dogmatically, narrow-mindedly focused on your way is the way kind of thing.
Yeah, like in the manual therapy training where you stand at 45 degrees and...
Right.
But you can bring so many other things into that.
Totally. I mean, But
that might work for somebody just standing at 45 degrees and... Sure,
totally. That'll work for some people, but also what if, like, I've seen so many times in the lab over and over and over that no C5 facet joint is the same from person to person.
Right.
Everyone's C5 is different, actually. And all you got to do is look to be convinced of that. It doesn't take any more than that. You just gotta look. And if you see the morphological differences and variations between people's systems, it's just your jaw will be on the floor because you'll be like, that's not what the book looks like. That's not what my training said. It's like, sorry to tell you, but that's the reality. That's the reality.
When I was in the anatomy lab, after like years of not being in a cadaver lab, one of the things that stuck out to me was we, learn in netters or whatever, the multifidi is this teeny little like crisscrossy muscle or whatever. And then even when we dry needle it, you're just getting this teeny, and then I was shocked when I was looking at the multifidi in the spine, like just how thick and robust and powerful that can be. And I'm like, well, that's interesting. That's not how we learned it.
Yes.
That's not how Netter drew it in the picture. It's like these teeny little like connections.
Yes.
Yeah.
No, especially over the sacrum and lumbar spine, they can be 2 inches thick. Yeah. They can be 2 inches thick.
I had no idea.
These multifidi muscles. I mean, it's extraordinary how robust these deeper spinal muscles are. 100%. And this is just a small side thing. I think a lot of what our work is, when we attribute it more into the spine, into the nervous system, I think we're engaging a lot more with the muscular system than we give ourselves credit for.
100%.
Because they're a lot thicker than we think they are, like I was just this past week, I did this anatomy project, and I was pointing out to a friend of mine who is a chiropractor. We went through chiropractic school together, and I was pointing out to him how thick the multifidi are over the sacrum, and he's like, oh my God, when I touch over someone's sacrum, I feel like I'm like right on their sacrum, but I'm seeing now that I'm going through 2 inches of superficial fascia and then 2 inches of multifidus before I hit the sacrum.
You just think you're on the bone there.
You think you're on the bone when you're not, actually. And I'm doing this SI joint adjustment. It's like, sure, you probably are, engaging with the SI joint, but you're doing that through 5 inches of soft tissue. Come on, people, kind of thing. So I thought that was a cool, like, aha moment that he had on that. Like, okay, more holistic conception of the human body instead of like just spine and nervous system. It's like, dude, there's so much more going on.
And I remember now, this is my aging brain that I have forgotten this already, but I remember Bonnie pointing out a muscle that none of us had ever heard of somewhere in this area. We're doing some pelvic floor stuff in the cadaver lab, and she was like, the such and such muscle. We're like, the what? Well, that wasn't in my anatomy book. What are you talking about?
Pyramidalis, maybe?
Yeah, that was it.
Yeah, I had a feeling. Yeah, pyramidalis.
We're like, well, how about that? Like, it's just so fascinating.
Yeah, pyramidalis is a fun muscle. Yeah, maybe...
I had never heard of it.
Well, it's a variation. Not everybody has it. You know, maybe that's why it's not drawn in Netter or whatever. It's because not everybody has it. But in any case, yeah, that's fun. Okay, so maybe last question, if this sounds good to you. A 2-part question. I love ending the podcast with this 2-part question. If you could give a bit of advice to someone who's looking to get into either PT or the health professions in general, someone who's looking to get into that, what's something that comes to mind that you could tell them as a bit of encouragement or advice, or keep this in mind or something? And then the same thing for someone who has already been in the health profession for a long time. What bit of advice would you give to them? Maybe someone with a bunch of experience and someone who is just looking to get into it.
So I would say for someone just starting out, find a good mentor or two. I feel like that was probably lacking early in my career. And I have some friends that had some amazing mentorships, from PTs or even like other healthcare professionals that were in their same clinic, working kind of like a hand therapist or whatever. I think having a mentor can be a huge asset when you're first starting out, and someone to, like bounce ideas off of, and if it's another PT that has more experience or has a specialty, like being able to have conversations like, hey, I've got this patient, what do you think about this? Because again, like early in my career, I didn't have that, and I felt like in my particular place that I worked, everybody was like, this is my patient, like, kind of like you don't want to share patients because somebody else might take your patient, and like you better act like you know what you're doing, kind of thing, so I want to be super confident, but just encouraging folks that there's always things to learn, like somebody next to you is going to know something completely different, and you might be able to share something in your experience. So just having those open conversations, and just being open to learning, and expanding your toolbox. Like it's not just there's many different like techniques and philosophies in the PT continuing education world. Like, are you a McKenzie therapist? Do you just think extension like is what everybody needs through the spine? Are you this? Are you that? And early on when I took a class, I was like, okay, everybody's getting this. Like I'm gonna treat, and just over the years realizing, oh, like it's a toolbox. Like not everybody responds to this. Like just learning different techniques and just being open to always learning and looking at other techniques that might help, and not just like the one. And then for someone who's been in it for a while, I think that we can sometimes, like older PTs can get kind of complacent a little bit, and this might be in any profession. Like I've been a chiropractor for 40 years, this is how I do it. I've been a PT for 35 years, this is how I do it. Again, just being open to learning, and like reading, and just opening up to like what some of the younger therapists or healthcare professionals are learning and coming in. And I've really like learned some great things from my younger PTs. They're getting a different education than I got. They've taken different continuing education classes than I've taken, and so like I love for them to come in and do end services during like our team meetings. And I think it's a good thing that Colorado requires now like PTs to have so much ConEd every 2 years, because like I think there was a time where we're like, I don't need to learn anything else. Like what I do works. Like I'm not going to change anything. So I think it's nice actually. And I feel like PTs are pretty good about wanting to learn stuff, but I know like I'm just talking like as we get older, we're just like, oh, my brain like is kind of done with this or that. But I think it's always nice to just keep open to like learning more, because the more I learn, the less I feel like I know. And I just like really get excited about all the things in the last 8 years, like the things that I've learned that have completely changed my practice that I never would have thought of 15, 20 years ago. So I'm just thankful that I was open to learning from these folks that were doing this weird thing over here. So that's what I just like learning, like having mentors and having friends that even in other professions like to talk through things with. Like keeping an open mind, for sure. Don't get stuck in a rut.
Yeah, beautiful, beautiful. I remember hearing a bit of a very similar thought from a friend a long time ago. He said, as soon as you think that you have it figured out, you have gone off the path.
Yeah.
And I was like,
agree.
whoa, that
know.
really struck me.
Yeah.
It's like you always want to stay humble and open to the possibility, and not even possibility, reality, that there's more that you don't know than what you do know.
100%.
For sure. So that's beautiful. Yeah, that's beautiful. Well, thank you very much for coming over and chatting with me today.
You.
I had so much fun.
Yeah, I love that conversation. Thanks for having me.
Yeah, me too. Thank you very much. All right, bye-bye, everybody.